Cerebrovascular diseases. The cerebrovascular diseases refer to a group of medical conditions that affect the blood vessels supplying the brain, including arteries and veins. These diseases can lead to various neurological symptoms, including tinnitus, due to their impact on blood flow and vascular function within the auditory system. Understanding the relationship between cerebrovascular diseases and tinnitus is essential for identifying potential underlying causes and guiding appropriate management strategies. Mechanism of tinnitus in cerebrovascular diseases. Cerebrovascular diseases can disrupt blood flow to the auditory structures, including the cochlea, auditory nerve, and central auditory pathways, leading to changes in neural activity and tinnitus perception. Ischemia, hemorrhage, vasospasm, or other vascular abnormalities associated with cerebrovascular diseases can result in neuronal dysfunction, excitotoxicity, and alterations in neurotransmitter release within the auditory pathways, contributing to the generation and perception of tinnitus. Types of cerebrovascular diseases associated with tinnitus. Various cerebrovascular diseases may be associated with tinnitus, including ischemic stroke, blockage or occlusion of cerebral arteries leading to reduced blood flow and oxygen supply to the brain, resulting in ischemic injury and neurological deficits, including tinnitus. Hemorrhagic stroke, rupture or bleeding of blood vessels in the brain causing damage to surrounding tissues and neurological symptoms such as tinnitus. Transient ischemic attack TIA, temporary interruption of blood flow to the brain, often considered a warning sign of impending stroke, which may manifest with transient neurological symptoms including tinnitus. Cerebral aneurysm, abnormal dilation or bulging of cerebral arteries, which may rupture and cause bleeding, hemorrhage, or compress adjacent structures, leading to tinnitus and other neurological deficits. Arteriovenous malformation AVM, abnormal tangles of blood vessels in the brain, which may disrupt normal blood flow and cause neurological symptoms including tinnitus if located near auditory structures. Clinical presentation and evaluation. Tinnitus associated with cerebrovascular diseases may present unilaterally or bilaterally and may vary in pitch, intensity, and duration among affected individuals. Clinical evaluation of patients with tinnitus and suspected cerebrovascular diseases typically involves a comprehensive medical history, physical examination, neurological assessment, and diagnostic tests, including neuroimaging studies, e.g. MRI, CT scan, to assess for structural abnormalities, ischemic or hemorrhagic lesions, and vascular pathology. Management and treatment. Management of tinnitus associated with cerebrovascular diseases focuses on treating the underlying vascular pathology and optimizing cerebral perfusion to alleviate symptoms and prevent further neurological complications. Treatment strategies may include pharmacotherapy, administration of medications to manage vascular risk factors, e.g., hypertension, hyperlipidemia, diabetes, improve cerebral blood flow, prevent clot formation, and reduce tinnitus-related distress. Interventional procedures. Endovascular procedures, such as angioplasty, stenting, embolization, or surgical revascularization, may be indicated to restore blood flow in cases of arterial stenosis occlusion or aneurysmal disease. Lifestyle modifications. Encouraging lifestyle changes, including smoking cessation, dietary modifications, regular exercise, and stress management to reduce vascular risk factors and promote overall cardiovascular health. In summary, cerebrovascular diseases can lead to tinnitus through their effects on blood flow and vascular function within the auditory system. Identifying and managing the underlying vascular pathology is essential for effectively treating tinnitus associated with cerebrovascular diseases and preventing further neurological complications for affected individuals. Early diagnosis, appropriate intervention, and multidisciplinary management are key to optimizing outcomes and improving quality of life for patients with tinnitus and cerebrovascular diseases.